Today, Sylvia King sits down to talk about Mira. Sylvia, thank you so much for being here.
Thank you so much for having me. I'm so excited to be here.
Yeah, I'm really excited for this conversation. Would you start off sharing a little bit about the Mira Fertility Monitor?
Sure. Mira Fertility Monitor is the device for home testing. So we test the multiple hormones for female, and they go from LH, estrogen, progesterone, FSH. So if you're not familiar with this, basically those are all the major hormones that regulate a woman's cycle. And our cycle health is very correlated with our overall health. And this is especially true when you're trying to conceive or you're trying to understand if you have PCOS, how to regulate your cycle back, and also things like postpartum, breastfeeding, even menopause. All these stages in the life are very closely with our hormone concentration. So with Mira, we use the very straightforward urine test. So you sample your urine in the morning, and you insert these test ones into our Mira analyzer, which is the small device fits into the size of your palm, and there's going to be a hormone reading or multiple hormone readings if you're testing multiple hormones coming out from the Mira analyzer within about 15 minutes. And all these numbers will be transferred to the Mira app. So on this app, you can see your hormone trend, the hormone curve, and you can see the correlation, like, their ratio between different hormones. And also the app will give you insights, like a personalized tips, what you could do. So all these tests are quantitative tests. So that means just like a blood drawing, you will get a number. You're not going to get positive, negative, this kind of estimation, because we all understand that our cycles are really personalized. Everyone's different. Every cycle is different. So we believe that by truly seeing your number and seeing the curve, and also see how curves are changing, how those patterns are changing for longer term, is the right way to understand what's going on. So for now, many women use Mira to try to conceive. We have already helped more than 100,000 users since Mira launched a few years ago, and we also have a lot of users, trying to understand their cycle, trying to, get rid of PCOS or put it more manageable way, and also people trying to understand the, how close they are to menopause, like a fertility level.
Okay, so you just covered a ton of things that the Mira Fertility Monitor is capable of doing. Maybe let's take us back and talk about, so when women are using this for trying to conceive purposes, what does it look like? Could we just maybe run through the hormones, those four hormones that you mentioned, and talk about how those change? Well, we could limit it even just to the three hormones, LH, estrogen, and progesterone. Talk about Mira, um, how to use Mira to track those, and how to know when you're approaching ovulation with those.
Sure, sure. So the in the uterine cycle, our hormones will go up and down, and they have to go in a certain way and a certain order for the ovulation to happen, and also for us to feel okay, to feel well, and our health is good. So the LH hormone, luteinizing hormone, probably is the most familiar hormone to most of people. Our LH hormone will surge. They call surge basically just going up really sharply about 1 to 2 days before your ovulation. And these 2 days are your most fertile days in the cycle. And if you have sex during those 2 days, and the basically, sperm can wait there for a little bit of time, like a day or so, and then the egg will be released, and then fertilization will happen. So that's why those 2 days are most fertile days. And however, during a very good health condition, like you have good quality of your mucus and your partner has a good sperm quality, the sperm can stay inside woman's body up to 6 days. So that means there are a few more days of opportunity to conceive before those ovulation happen and before the LH surge happens. And luckily, we have a hormone, which is estrogen, and in urine, we have a metabolite, and we call that one E3G. So this hormone will sharply go up usually a few days before LH surge. So that means if you measure LH and estrogen or E3G together, and you should be able to capture about the, every day, everyone's slightly different, but, 4 to 6 days before ovulation will happen. And those up to 6 days can be all fertile days for you. So if you have sex during during that time, you have a chance to conceive. Obviously, if your intercourse is happening closer to your ovulation day, and the chance should be even higher. So those two hormones should be able to tell you your entire fertile window. If you're trying to conceive, you're really seriously trying to conceive, you do want to capture every single day, every single opportunity in the cycle. And then another hormone is progesterone. So this hormone will start to increase after ovulation has happened. So that also means if in the cycle you don't have ovulation, and then your PDG or progesterone will stay pretty flat, it will not have this surge. And this is very important. It's like this is like a double security. So it's like after ovulation happened, I can go there to check. Yes, it truly happened. Because there are many cases your body was trying to ovulate, but it doesn't really happen every single cycle or every single attempt. And this is very true for people with PCOS, because we tend to have multiple really small follicles developing in the cycle, but every cycle sometimes there's no really mature single follicle being released, or there's the multiple attempts, and we don't know which one got mature, which one being released or not. So there are many confusions. And then when your body was trying to release the follicle, and you will still see the estrogen increase and the LH increase, but you don't know if that's true or not. You probably could see even multiple times of LH peak or estrogen peak. So that's where you need the progesterone to come into play. So progesterone, if you see that increase, and you can be rest assured, yes, the ovulation happened, egg has been released. So if you test all these three hormones together in the cycle, and you should be seeing a chart, and you should see two peaks, earlier in the cycle, and that's LH and estrogen. That means your ovulation is happening. And also you see a later peak, which is progesterone. That means ovulation has already happened. So by mapping out all three hormones together, you can see a super clear picture about what's going on with your body and what the body is doing at any given point, any given day in the cycle. So that's so much more clear than traditionally if we just only test with OPK, and that's only test the LH surge. You got one day positive, and all the other days are negative. So you feel like you're in a blind box. You don't know really what's going on.
Yeah, and I think one of the things one of the things that I love about the mirror, no thinking about it, is the fact that the Mirror Fertility Monitor shows a value for all of these. It's not a qualitative test, it's a quantitative test. And I love that, because I feel like these OPKs, a lot of times that LH threshold is set at, say, 25, and some women are entirely capable of ovulating at LH surges lower than that. So they would never even see it on an OPK.
Exactly. I cannot agree with you more. So we have already have so many users using Mira, and we saw their backend data, and there's as low as even the peak value, the highest value for LH was like an 8 or something, and that person still ovulated because you can see the progesterone surge afterwards. And there's also people, LH can go really high, like a 40 something, and their baseline will start to increase a little bit higher too. So if you test with OPK, that person gonna get multiple days of positive. So it's really confuse you because you don't see the number, you don't see the trend, you don't see where your baseline is at. What's the definition of your baseline, not the population average of baseline, and also what's the definition of your peak. And if you compare those ratio and the trend, and you can say, okay, now it's the peak, now it's a surge, now it's a true surge. My ovulation is happening. So I think that we all know, the trying to conceive journey is not that straightforward as we imagined, a few years ago or 10 years ago. So many confusions and many stress. So if you can see how your body is functioning, where we are in the cycle, what exactly is going on. And then sometimes you can even spot issues with your body, like a red flag if you don't have ovulation for multiple cycles. If you don't have ovulation, you can still have periods sometimes. If you don't test the hormone, you have no idea. And sometimes we bleed during the middle of the cycle. We don't know what's going on. And that's also, most of the time is caused by hormone fluctuation. So you can tell what's going on. You can tell where might have gone wrong, and you can change your lifestyle or see the doctor earlier. And that clarity really release a lot of stress and unnecessary anxieties during trying to conceive.
Okay. I've got a couple of questions kind of around this, specifically regarding uh, staying on this quantitative values for a second and speaking more to the estrogen side of it, because and here it's calling in using cervical mucus tracking versus using these hormone values to know when you're entering your fertile window. And where I'm going with this, the question that I really have is, how does this apply to women who have ever used or are currently discontinuing hormonal contraceptives? Because I feel like so often that kind of interferes with our body's ability to make cervical mucus in a meaningful manner.
Yes, you're totally correct. So usually when your body's going off from birth control, and again, everyone's different. Some people got back, cycle and the hormone level got back really quickly. So like within a week, and she's totally regular. And then some people takes like 3 months or even more for the body to completely deplete all this, hormonal birth control substance in your body. So everyone's really different. And so for that case, I think a tracking hormone will definitely be helpful. And the mucus is something caused by estrogen surge. So as we mentioned, estrogen involves these major hormones we're tracking. So when your estrogens increase, your body will secrete more, mucus. I'm not against the mucus. I think it's a pretty good way to track. I'm not saying like this will be the 100% accurate way, but I think it's a good practice to pay more attention to your body when we're trying to kind of say we're going off from the birth control situation. And you will say everyone's so different, and sometimes my body right now is different from my body 5 years ago. So be really mindful and be able to train yourself to observe what's going on, and including mucus, including hormone test. Maybe you use BBT whatsoever. I don't think those one will hurt you. I think will only train a more mindful mindset, and this can maybe help you to discover something. But going back to a question for after going off birth control, yeah, I think give yourself a little bit of time. Don't be too much hurry, because we don't know where your body fall into. It can be 1 week you're totally clean, or you can be taking like a three months and your cycle is still kind of messy. So track your hormone, and you can, those three hormones we mentioned. You can see if the ovulation is coming back, if that's regular, if ovulating at the supposed to be the middle of the cycle, correct time, and also observe any bleeding, any mucus change whatsoever. I think that will be really helpful. If you still see irregularity or like a pain or bleeding after 6 months or so, going off the birth control, you probably should see a doctor. We had the many customers like that. They went through their first baby was really easy, and the second baby, I think they call it secondary infertility or something. Second baby after going off birth control take a while. So many things could be done. Tracking your cycle, seeing the doctor, or getting some drugs and some medication to help, and or relaxing meditation, dietary, many things we can do.
Okay. Um, Another kind of question along this lines is for because the Mira is looking at that E3G metabolite, um, is there any opportunity for, and you know, maybe I'll just ask you offline actually afterwards in case you, so it's not recorded. And then that way, if it's something proprietary you're working on, we can
That's okay.
tell. Okay, well, the question that I was really curious about is for women who are discontinuing birth control, is there a way to track those metabolites of the synthetic estrogens and progestins with the Mira?
That's
Because
actually, yeah.
they're not necessarily showing up as the same metabolites.
Yeah, so I think that's a very good question. I think that one we need to run some tests. The Mirror will capture your estrogen in general. So if that I think also depends on what birth control drug you're taking. If that one will play similarly in terms of function as your natural estrogen, yes, Mira may capture that, but that will show up differently on the curve for sure, because your estrogen is supposed to only increase around the ovulation, but if your body still have some residual of other hormone or like a similar substance that interferes with the test results, I don't think they will show up in just like ovulation, probably will show up as a higher baseline or whatsoever, or lower baseline. And you can also look at the relationship with other hormones. For example, as we mentioned, estrogen is supposed to increase few days before the LH increase. And if you don't say your LH increase, only really high level for estrogen, that might be something pretty suspicious. May not be your your natural estrogen or truly being the ovulation. So there are many things you could do. And also on the mirror side, when on our R&D side, we have tested against many interference materials during the test. So that means, many other things, like for example, vitamin D or what you're eating, some other medication, they could also have some interference with the test results. But most of them show the pretty low interferences, which shouldn't affect your test accuracy.
And speaking of those interferences, I think I've seen my own interferences before while taking an over-the-counter UTI treatment. The one of the ones that it's I think it has something to do with fluorescence or something, and I saw like a pretty dramatic spike in my curve over the time that I was taking that. So it was pretty interesting. Is there a way to see what some of the common drugs are? Do you have a list on your website of some of the common drugs that may interfere with readings?
Yes, we do. It's actually in the instruction manual for the product, and that comes
Oh,
with
okay.
every single analyzer and the test ones. There's a list of materials that can interfere, but as I mentioned, most of the interference are pretty low, so you should be fine. And then obviously, if your body is generating more hormone or less hormone due to the drug itself, Mira will capture that for sure, right? So because Mira basically capture what's going on with your body, regardless you're taking a medication or not taking medication. So we have a lot of users and they are taking Clomid, doctor prescribed to them, and they need to have a not like an FSH injection, but like a still stimulus cycle, but a more lower range of stimulation. And the mirror definitely capture this much higher estrogen values than the natural cycle.
Okay.
Mm.
So how did you actually arrive at the mirror? Like, how much research went into that monitor? Because I mean, it is, I, and correct me if I'm wrong here, I believe it was the first one on the market that actually provides the quantitative value.
Yes, that's correct.
Okay.
Yeah,
Because
so a
I
lot of
mean,
research went into there for sure.
because it's so much different from the Clear Blue fertility monitor. I mean, we can even the Clear Blue, you're limited to just estrogen and LH. It doesn't even test progesterone. But yeah, I'll let you get back to it a little
Sure,
bit because
sure. Yeah, sure. So yes, a lot of research definitely went into there, and all the other like a Clearblue and there are other like OPK, and now there's some smart OPK, like a people take a picture of OPK by the cell phone and they will be recorded in your app. So all this technology are mostly based on a qualitative technology. So the OPKs are based on something called the nano gold. So that reaction itself is totally different from what we use, and we use immunofluorescence. So that's a very close technology to the lab test, like a blood drawing lab test. And we choose the urine sample because that's easier for consumer to handle. And nobody wants to pinch the finger every single day. It's really painful. So we spent multiple years in the research, and how to get our initial idea was to really bring the lab test to the user's home, because for fertility, for hormone tracking, you kind of need that like a daily basis. Daily basis means probably 10 to 20 times per cycle. So it's not very possible you go to the lab to do that, say to really go there. And if you use the over the counter products, like most of the OPK is very confusing, already mentioned, positive, negative. You see, positive, negative, you have to decide for your user what is the threshold, and that threshold cannot be dynamic. So then it's for people with higher baseline, lower baseline, they got false positive, they got false negative. They only test one or two hormones, doesn't really say the chart. So all this gives user more questions than the answer. So even more stress during the trying to conceive journey. So with all that, our initial idea was that what if we can shrink lab equipment to a really small thing and need to be easy to use and they need to give the relatively accurate data, and it needs to also be affordable because we're facing, general users right now. That's where the research started, R&D started. It took a while, and many iterations, and even our analyzer, the version you're seeing right now is probably already the fifth or sixth versions, and this is like a big change, not like a small iterations. So many things went into there, and also how the system should be integrated, how the analyzer should be integrated with the test one was another technical challenge. You want to have certain level of performance stability, and because this is lay user, scientifically speaking, this is lay user device, right? So it's not being used by doctors, so you kind of can control where this test will be performed, its condition, environmental condition, and sometimes they don't perform in the correct way. So all this has been factored into the consideration for the design. And also there is a lot of simplicity, like basically how to make this experience really straightforward. And for any lab equipment, there was a calibration stage. So you have to calibrate the device when you turn that on and you run the experiment, run your samples for a whole day, you turn it off, and next morning you come here again, you put the standard sample in there, calibrate. And all this on Mira was done automatically. We also have that stage, but we do that automatically, so users don't have to do it. So you can see so many factors in there. So it took a while, but eventually we reached what we have today. You're true. This is still the only, not even just the first, only truly quantitative test on the market, and this gives us a huge value. Gives our users huge value too. I think people see their curve and see what's really going on, the relationship among different hormone patterns, and that's super exciting, super useful. And for us, we see, with those quantitative values, we can truly get a lot of meaningful data, and we understand, how, on the public health level, and also a lot of research level, how female cycles are really going through. And for example, how our cycles are affected by our stress, our mood, or environmental factors, even some diseases such as, now post-COVID. We're partnering in a lot of studies like this. And those university research institutes and the fertility clinics, they also see the value for that too. And that quantitative data really open the door for us to, provide, give Mira more opportunity to participate or improve the female health study, like a women's health study. I'm a strong believer that there's a really huge lack of women's health research. Many problems being majorly faced by females. And in the clinical study, the representative or the participants chosen were mostly male. And there are many female-related diseases such as hormone issue, hormone irregular issue, PCOS, all this like a kind of like a chronic problem not being understood really well, including infertility. So we don't really know what went wrong, and we don't know how to do it. So that's why a lot of our users, when they trying to conceive, they just can't get pregnant within 6 months, and they were sent immediate to IVF. So just go to IVF because doctors, I don't know what's wrong with you. I don't know how to treat this. Just do IVF. It's a tool to help you to reach your goal. We just skip this reason. I don't think that's what we face today, but I don't think that's the ideal world. There should be more investment, more understanding data, meaningful data going into women's health research. So that's another huge benefit I think this, quantitative hormone tracking can provide to our society.
Yeah, I love that. So are you working to grow a network of doctors, or has a network of doctors already started, and other healthcare practitioners that are really using this in their practice?
Yes, that's correct. So we do have some doctors already using this, and there are assorted different applications, as I mentioned. On the clinical side, IVF treatment and IUI treatment, and even some, natural cycle, frozen embryonic transfer, all these things. And the other fertility clinics found Mira to be really helpful because that gives them the immediate access to the into the users, the patient's data about what's going on, and provide much more convenience. There's a lot of blood drawing, ongoing in the in the IUI, in the IVF, and a lot of them are pretty painful. The users or patients drive to the lab to draw the blood 6 times, 8 times per cycle. Just go there, drive for half an hour, take 10 minutes to draw the blood, and just go back. And miss work, have to take off from the work, and fit into a busy schedule. So it's pretty challenging for for a lot of people. So the clinics definitely found that to be really helpful. And also on the research side too, we have a lot of collaborating doctors. They want to understand better about the how the treatment can be improved, how the outcome can be improved. So for example, PCOS, I think that's a very popular problem nowadays. And we have a not enough understanding about that. We have some patterns, already mapped out for how the hormone cycle for PCOS patients look like, but we don't know the cost, and we don't know when it's come to treatment and how the outcome is at. And most of the PCOS is not being treated. It's more like just the you take a Clomid and stimulate your ovulations, you can achieve your goal. And usually that's about the trying to conceive. So then, but for this this kind of thing, if you can understand what's going on with the cycle in the for example, you take a whole bunch of data set and you can break them into different groups, different characteristics, and there will be association of those characteristics linked with your age, patient's age and lifestyle, some other factors, or some other genetic problem, or like environmental problem, or so on. I think there's a huge understanding about what factors has a correlation with this kind of disease, and then it can lead to actions about what we can do. So Mira has been participating in a lot of studies like this too.
Yeah, and I think that piece of it is so powerful for women who are really trying to navigate their own health and help themselves overcome PCOS, because you can use it as a real-time tool at home when you're making these diet and lifestyle changes to see how well things are going from cycle to cycle.
Exactly. So that's what our users already been doing. I'm also a strong believer that I think we should empower our users, empower consumer, empower women to control their own health. Traditionally, there's some belief in there. Some doctors even believe that I don't want our patients to see the number. I don't want them to see the data because they will get panic. I will get so many calls, and it's not gonna help. It's just gonna go to the wrong direction. I'm really against that. I think we should empower our patients and our general consumer to be the owner for their own health. I think Mira already achieved significantly in here. We give our users all their data. They don't panic. They make good decisions. They don't worry about things they shouldn't be worried about. It's actually relieves their stress. And for, as you mentioned back for PCOS, when people see their hormone cycle and hormone level and in the cycle, and they understand, okay, so here maybe I'm not ovulating, or my body might be attempting ovulation, but it just doesn't happen. And many times people just don't know even they have this issue, or they don't know when ovulation happened. Maybe I tend to ovulate a little bit earlier or a little bit later. I just don't see that. And that actually already eliminated a lot of unnecessary down-term issue. Like many people got pregnant with Mira, so they don't have to go through IVF. They don't have to go through IUI. A lot of cost, healthcare costs being saved, and a lot of pain from the patients, and the burden from the doctor side being saved too. So I think with the accurate and scientific information, and also with the correct level of interpretation and the support, with Mira, we have an algorithm to to help them understand what does those data mean, what they could do. And we also have partnering telemedicine doctors. So if they want to, getting a deeper level of understanding, if they have complicated health issue or some history, health history, they want to have a discussion in a personalized way. They can reach to the telemedicine doctor, and the doctor also has access to their Mira data as well. So with that, we already have seen that many unnecessary pains during this fertility journey has been eliminated. I think that's a way to go in the future too.
Yeah, and maybe another question kind of along these lines is with regards to women who have had miscarriages in the past and whether Mira provides any data, and here specifically that progesterone piece of it, any data into potential luteal phase deficiencies or trying to catch that so that they're able to treat those to carry their next pregnancy to term.
Yes, that's for sure. So, post miscarriage is really common right now, especially for women who are 30 years and above, 35 years, and they're trying to conceive. Many of them had a miscarriage history before. So with Mira, you can track the hormones, and when your miscarriage happened, and it's gonna take a little bit of time for the hormones to come back to normal. So you can track your hormone in that way and to understand when miscarriage has been completed and give your body the correct timing to try to conceive for the next time. And regarding the some other hormone pattern like a luteal phase deficiency or so on, I think that is definitely associated with the difficulty of trying to conceive. And there are many kinds of different issues. And if you test your progesterone, and you can see how the length and the of your luteal phase, and then where the level of PDG or progesterone will go. I think that's a very good way to understand if there are any issue with with your hormone of luteal phase or with your hormone for progesterone. And then going back to this miscarriage issue, many of the miscarriage during early stage is actually caused by genetic problem. So for that, there's little stuff we could do. Just the equality, after when we're getting older, the equality just not becomes that good. And if we, there's an egg that with the not a very healthy genetic situation being fertilized, and your body will try to eliminate that fertilized egg by itself. So that's why most of this miscarriage has happened. So there's really not much medically we could do. Usually doctor will just let that one pass, see there's miscarriage, and you just let it miscarriage. But what we could do is really track this miscarriage to make sure that's been completed, and then make sure your body has the correct time to recover. Usually that when although medically they don't require the recurring period, but your body is the best. Everyone's different. Going back to what we said earlier, there's a lack of research in personalized female health. So whenever you feel like your body is ready, you're ready, and you can start to try to conceive again.
Okay. There was something else I wanted to ask. There was a sort kind of so kind of switching gears a little bit and moving from our talk about fertility over into perimenopause. So actually, yeah, let's do that first. And then I wanted to circle back around to fertility and talk about some of Mira's other products as well. But for the time being, we'll wrap up our conversation around the fertility monitor. So when we're talking perimenopause, what are some of the options that Mira provides to be able to track that or see that menopause may be approaching?
Yeah, sure. So that's a very good question. Because we found that now everyone's trying to delay their maternal age, and many women, I got pregnant when I was 36. So, many women really trying to get pregnant much later. And unfortunately, the menopause onset could already start to happen at that time. And the menopause is another myth we don't understand. That's my thought. So we usually think, oh, menopause, 50 years old, you got menopause. But there's many people having really early perimenopausal symptoms already, and you have a declined egg quality. So sometimes can even go as early as 40 or like even 35. You start to have those symptoms. So Mira launched a new product last year, which tests the FSH hormone. So FSH has two use case in your cycle tracking, and the first one is during the baseline. So when we say baseline, it's usually day 3 of your cycle. So that means the hormone surge didn't happen yet, and you can test your FSH. And at that time, FSH should stay quite low. If the FSH level is high, that means there's a diminishing ovarian reserve already. So, and then another use case for FSH is during the time for ovulation. So the FSH also has a peak just like LH. So this is like a triple confirmation for your ovulation, right? So if you have a healthy cycle, you should say LH, estrogen, FSH, all surging around the same time. So you should be very confident. Yes, there's ovulation that's about to happen. So Mira launched that product end of last year. And also we suggest you to test together with estrogen too, and maybe your progesterone, because again, progesterone will confirm ovulation has happened. If you're older age or you feel like you doubt you're already close to perimenopause, you probably do want to have this double confirmation about the ovulation truly is happening. And estrogen is the very important hormone in general for female. When you're going through menopause, your estrogen will drop, and that causes a lot of discomfort and a lot of issues like even hot flash, mood swing. All these things are linked with the estrogen level. So estrogen together with the FSH and with progesterone, and those are a pretty good combination for you to track the perimenopause.
One more question about those FSH levels. So you said that day 3 is generally a good baseline. What about for women that have a short follicular phase? So maybe they're ovulating on like before day 11 of their cycle, for instance.
Sure. So the day 3 is just the general guidance, and that means you need
Okay.
to test. It just means you need to test FSH before the surge has happened, right? So if you have a really early ovulation, maybe you ovulate on, I don't know, day 9, day 10, and the FSH surge is not like estrogen, is a much shorter time. So you probably want to test like I would still say day 2 or day 3 will be pretty safe. You basically leave enough room before this surge has happened. And in your baseline, the FSH usually goes pretty consistent level. It's not tend to fluctuating up and down so much. So as long as you capture that baseline, it should be fine.
Okay. Um, I think one more question is here specifically around the Mira is for women who are postpartum, and in that so one question would be, at this point, why would they necessarily care about charting? Because they're not in that TTC space. And then what benefits the charting would give. So I guess they're kind of tied together.
Sure. Yeah, so I think one common use case we found for people postpartum is they want to understand when their period will come back. And I think there's a general interest for that. There's also another interest about they don't want to get pregnant. They don't want to get pregnant immediately. But this, when period comes back, it highly varies. Like some people come back in the second month, some of the 6 months, sometimes after a year, and the breastfeeding play into the role there too. Some people don't breastfeed at all. Some people breastfeed until the baby is 2 years old. So there's a huge variability, and people want to understand, okay, what's going on with my body during this time. You probably don't want to get pregnant immediately, or some people are planning for kids, maybe wait after years. They do want to get pregnant, but they found their cycle can be really different. My cycle is very different after postpartum compared to before I was pregnant. Many things have changed. Your hormone level changed, your cycle length changed, your period flow is different, and you start to think about, at least I started think about, is this normal or is there any issue? And I start to text my OB. I'm like, okay, so is this okay? Is this normal? And usually they will tell you, as long as your cycle is still regular, you don't have any discomfort feeling, it's fine. But if at this time you're trying to conceive again, you probably need a little bit more detailed information, then this fine, because your ovulation time may have changed because your cycle length is even different right now. And your hormone level can be different too. So OPK, if you use OPK, can give you a different set of answers than before you were trying to conceive the first time. So that's usually the use case for people, they care about the cycle tracking postpartum. And the mirror has been pretty helpful to them. And another thing is just to add on this is that our ovulation happens before the first period. So you probably can think, okay, I can just track my period. If my period comes back, that means everything's okay. But your ovulation happens first. So you still have a chance to conceive, even before your ovulation first period came back.
Yeah. Okay, now kind of switching gears and expanding beyond just the Mira Fertility Monitor. What are some of the other things that Mira offers for those on their TTC journey?
Yeah, so Mira offers a lot of education, a lot of information. I highly recommend you guys, our audience, if you haven't done that, and go to Mira's website, which is miracare.com, and you can register our newsletter or follow us on Instagram, which is Mira Fertility, at Mira Fertility. There's a lot of information there. Much more than just a test. So for example, I know people want to know, okay, well, after my test is done, what should I do? So there's a lot of article about this, and in the Mira app, there's tips about that, and there's some personalized plan just based on your results in the app you can access with. And we have a ebook to talk about trying to conceive, and we also have a course on our website. It's like a online course, like a whole bunch of doctors talking about trying to conceive 101, and that's with our promotion is free, and also it's really low price if you want to purchase that. And we also provide people with support. We know in addition to education, you want to you need some tools. So we sell a meditation course that's just for trying to conceive people. We know that stress plays a significant role. We're already busy enough every day and stressed enough every day. And plus now there's a new task for trying to conceive. Oh my gosh. So that's really stressed out. Really, it can be all this research, troubleshooting during trying to conceive can be kind of like a full-time job sometimes. So yeah, so it's like that. And there's also other, we have some fertility vitamin supplements, teas to make you feel better, providing the nutrition you need to support your body at the time of trying to conceive. So basically, Mira we're still developing in those areas, but we're really trying to be your best friend, best supporter, and also with the correct amount of knowledge and expertise to guide you through this journey. We know that journey is tough, so we start from scientific testing to know just your body, and then we have this software and hardware and telemedicine doctor whatsoever together to have an ecosystem to give you the panoramic support during the trying to conceive journey.
Sylvia, thank you so much for your time. As we're wrapping up, I think you just shared a great way for people to connect with Mira. I know you've already mentioned your social media. Are there any other ways or is there anything else you want to leave with the audience, and any other ways you want to share for them to connect with you?
Sure. Yeah, I still want to mention again that go to our social media, Mira Fertility on Instagram, and go to our website, sign up for newsletter. They're all free. So a lot of really fantastic content there, fantastic tip over there. And maybe last thing I want to share is I just have gone through a pregnancy journey too, and I know that it's not easy, and a lot of confusion, a lot of uncertainty. My trying to conceive journey was relatively okay, but in the pregnancy has a lot of uncertainty and the postpartum recovery is another myth. I don't think we really talk enough about that. So as a founder for a femtech company, I think I truly understand, I share the issue and the lack of support in a lot of femtech, or like or the female lifestyle, or like a different life stage, and we're really trying to develop the best product. So if we have the fortune to really serve you, and come to we're more than happy for you to come to the Mira platform. And it's not about just selling the product. As I mentioned, many contents are free. I'm just trying to support more people, trying to have more influence and to change our this common issue in the femtech we're facing right now.
Thank you so much for your time, Sylvia.
Thank you so much, Brandy. I was really happy to be here, and I was so satisfied, or so excited to share my insights with you and your audience.
Yeah, this has been a great conversation.
Thank you.